The number of cases has risen in the past few days, and this has happened right across the UK, and I'm obviously concerned about that. There is no inevitability to a second peak. It depends on the actions that all of us take. Of course, in government, we're concerned about this and we keep all options open. But everybody's got a part to play. I want us, if at all possible, to get to a position where we can all have the sort of Christmas that people yearn for. But that will require everybody to play their part, to follow the social distancing, to follow basic hygiene. The hands, face, space concept has been developed as an easy way to remember the three single most important things that individual people can do.
There are obviously some big problems in testing capacity right at the moment, notwithstanding those big ambitions. And Sarah J. Marsh, who heads the testing programme, put out a tweet this morning apologising to people who can't get a COVID test. And she says that it's not the testing sites that's the pinch point, it's the laboratory processing. How soon do you think it will be before those issues can be resolved?
In the coming weeks, we're working on it incredibly hard. Sarah J. Marsh is leading that. She's an absolutely exemplary leader and we're doing everything that we can. We have had these operational issues that I've talked about. We've had a problem with a couple of contracts, and we discussed some of that in the House of Commons. But it's a matter of a couple of weeks until we can get all of that sorted. In the short term, in the immediate term, we've already put in certain solutions to ensure people don't have to travel more than 75 miles. I appreciate 75 miles is far longer than you'd want to go, and indeed the vast majority of tests are much closer than that. We've also successfully continued the rollout of asymptomatic testing to care homes, even despite these pressures, because of the importance of that.